A torn meniscus is one of the most common knee injury. Any activity twisted or rotates the knee, especially when carrying full weight on it, can tear the meniscus. Each knee has two C-shaped pieces of cartilage acting as cushions between the shin bone and thigh bone. A torn meniscus causes pain, inflammation, swelling, and stiffness. You may also feel a blockage in your knee movement and have trouble fully extending your knee. As I said, the meniscus is a hard, rubbery, shoe-shaped piece of cartilage acting as a shock absorber between the shin bone and thigh bone. Sudden twisting of the knee while putting weight on it can cause a tear. Conservative treatment such as rest, ice, and physical therapy and take the medication is sometimes enough to relieve the pain of a torn meniscus and give the injury time to heal itself. However, in severe cases, a torn meniscus will require surgery. For minor meniscus tear, it may take 24 hours or longer for pain and swelling to begin. Your knee may have the following signs and symptoms: a popping feeling, swelling or stiffness, a feeling of collapse in the knee, the buckling sensation, pain especially when twisting or turning the knee. The knee feels locked in place when you try to move it. Difficulty fully straightening the knee. A torn meniscus can be caused by any activity. First, the need to twist or rotate, such as sudden sharp turns or sudden stopped and turns. Kneeling, squatting, or even heavy lifting can sometimes tear a meniscus. Degenerative change in the knee with age can cause a torn meniscus without trauma. Performing activity aggressively twist and rotate the knee puts at risk of tearing the meniscus. The risk is especially high for athletes and general population who participates in high pivot as well as high contact sports activities such as table tennis, tennis, badminton, and pickleball, football, soccer, and basketball. Even if you don't play any of the above sports, your risk of meniscus tear increase as you gain weight, lose muscle mass, and wear and tear your knee as you age. A torn meniscus can make your knee feel like it's collapsing. You cannot move your knee and can cause ongoing knee pain and can also make your injured knee more likely to develop osteoarthritis. A torn meniscus can often be identified during a physical examination. An orthopedist or physical therapist can make a diagnosis by examining several manual tests and specific posture and movement. For more detailed diagnosis, the patient take X-ray, ultrasound, MRI, or arthroscopy. Treatment of torn meniscus is often divided into surgical and non-surgical treatment, depending on the type, size, and location of the tear. Arthritis-related tears often improve over time with arthritis treatment, so surgery is usually not required. Many other tears not related to locking or blocking knee motion do not require surgery because symptoms improve over time. Your medical doctor might recommend rest, ice, over-the-counter pain relievers, and also physical therapy. Physical therapy can help to stabilize and support the knee joint by reducing pain around the knee and strengthening the muscle of the leg through electrical therapy, manual therapy, therapeutic exercise. That's good for circulation, decrease the pain, remove stagnation as well. If your knee continues to hurt or locked up despite physical therapy or other conservative treatment, your doctor may recommend surgery. It's sometimes possible to repair a torn meniscus with physical therapy or other conservative treatment, especially in case of children or young adults. If the tear cannot be repaired, the meniscus can be surgically trimmed through a small incision using an arthroscopy. After surgery, physical therapy is required to increase and maintain knee RM strength and stability. If degenerative arthritis has progressed, an orthopedist may recommend a knee replacement. In young people who have post-operative signs and symptoms but do not have advanced arthritis, meniscal transplantation using a cadaveric meniscus may be appropriate.